Cardiovascular disease is the leading cause of death in women. In fact, 1 in 3 experience cardiovascular disease and/or stroke during their lifetimes. Because February is Heart Health Awareness Month, we are bringing in the experts to keep you informed. Dr. Stephanie Gross from RGG Cardiology is joining us now with more information on how we can just take better control of our heart health. Hi, Dr. Gross.
Hi, thank you for having me.
Absolutely. Always a treat to have you here giving some much needed advice with this. You know, we're looking at heart disease, and during the commercial break, we were talking about a new category now affected, and that's single moms.
Right. You know, women have a significant risk for heart disease that they don't really think about it because but heart disease is the #1 leading cause of death in women. And some of the newer studies have shown that single women actually are in a subgroup that has a higher incidence of cardiovascular disease and a higher risk of dying from cardiovascular disease. There's been a couple studies recently, and it hasn't really been delved into in detail, but there are a lot of things that we think contribute to that. There are several key indicators of heart health, but there are significant financial stresses on single moms. They tend to ignore their health, which we know among women is a significant problem. There tends to be a higher risk of smoking among single parents, women especially. So you add all this, the stress of raising a child, which we all know takes a village, the stress of, the financial stress of single parenting, the not having a co-parent, higher risk of smoking, they tend to ignore their health, and all those things contribute to a higher incidence. It all kind of spells watch out.
Right, and talking about stress levels during this pandemic, we've all been tested and had to adapt. You're actually seeing more people coming in, though, with symptoms they think might be related to heart disease, but not so the case?
Yeah, we've seen a couple different things, so we've seen a lot of atypical patients. We've seen a lot of patients that are coming in that they think is their heart. They may be chronic heart disease patients. They come in with symptoms of fatigue. They come in with symptoms of myalgias. And I've seen several patients in the last couple months, and we've actually had them go get COVID tested, and they've had COVID with very atypical symptoms. It's a very strange virus. It's got a broad spectrum of symptoms, and not everybody has the classic cough, fever, chills. So, we're starting to be more and more alert to a broad spectrum of symptoms. In addition, we've seen people that have had COVID that are having the long haul symptoms, and these are really just very strange. People have had rapid heartbeats, people have had prolonged chest pain, people have had prolonged shortness of breath, people have had if they had high blood pressure, their blood pressure is now low. If they never had high blood pressure, now their blood pressure is high. And it seems to affect multi-systems, and many of them are cardiovascular, and so you have to react and evaluate and then support and treat.
Right. Well, listen, the message here I'm getting from you is to take care of yourself. Dr. Gross, I appreciate you for stopping by. Wish we had more time.
Well, thank you very much. Take care.
Thank you, you too. And you can watch this interview again or share it with someone you know. Head to our YouTube channel and be sure to click subscribe so that way you never miss a new story posted.